My name is Sarah Anvari, and I'm an assistant professor of pediatrics in the Department of Immunology, Allergy, and Rheumatology at Texas Children's Hospital. How does a food cause an allergic reaction? A reaction begins after you eat a food that you could be allergic to. The food will travel to your intestines and be broken down into smaller proteins that can be absorbed into your bloodstream. These proteins, also known as allergens, will be recognized by cells in your blood known as antigen or allergen-presenting cells. The antigen or allergen-presenting cells will present the allergen to T cells, which can recognize the food protein to be dangerous. The T cells can release chemicals into the bloodstream that will activate B cells, which can produce a protein against the food allergen known as IgE. The IgE, made specifically for the food, will bind to allergy cells known as mast cells and basophils. When an individual is re-exposed to the same food, the IgE specific to that food will immediately recognize the food protein. The IgE binding to the food protein will send signals to the mast cell and basophils and cause them to release chemicals into the bloodstream. These chemicals, such as histamine, are responsible for the symptoms seen in an allergic reaction, such as hives, swelling, vomiting, and/or breathing difficulty. The onset of symptoms in an allergic reaction can be noticed within 2 hours after ingesting the food, but many times symptoms can occur within just a few minutes. Symptoms of an allergic reaction can include one or more of the following. For example, skin symptoms can include flushing of the skin or itching or raised bumps or hives on the skin, swelling of the lips, tongue, or swelling of the eyelids, ears, throat, or face, or eye itching, watering, or redness, or even ear itching. Respiratory symptoms can include nasal stuffiness, a runny nose, sneezing, shortness of breath, coughing, a change in voice, wheezing in the chest, or pain with swallowing. Gastrointestinal symptoms can include cramping abdominal pain, vomiting, or diarrhea. And cardiovascular symptoms can include lightheadedness, loss of consciousness or fainting, confusion, or low blood pressure or heart rate changes. It's important to immediately identify these symptoms and to not delay treatment. Is there a cure for food allergies? Currently, there are no FDA-approved therapies. Avoidance is the only way to prevent an allergic reaction. Early recognition of symptoms of an allergic reaction is important to prevent serious health consequences. Epinephrine is the only therapy to treat a severe reaction.